When you're suffering with tooth pain and you go in to see a dentist, what's the first thing that dentist does? They take a look inside of your mouth, right? And they do that to see if there's any glaring abnormalities that might help explain the pain that you're having. Seems reasonable, doesn't it? Do you think that same type of basic visual inspection could be valuable for people suffering with chronic pain? Well, you would think that the answer to that question would be a resounding yes across the board, and yet there's a camp within the healthcare community pushing this idea that posture has no relationship to pain. Now, not only does this position defy common sense, but it's in direct conflict with a mountain of scientific data. But rather than just showing you a bunch of studies, I thought I'd take you with me as I work with a chronic pain sufferer so that you can see firsthand the critical role that posture correction plays in the resolution of one of the most common chronic pain problems in the whole world. Let's get into this. Recently, a patient named Steve came to see me complaining about severe pain in his neck and upper back that had been going on for years and years. He also had extreme stiffness and movement restriction, and over the past few months, a situation has developed where every time he tries to move his neck, he gets a lot of popping and clicking, which is uncomfortable for him and understandably has him worried. Now, what's notable about Steve's history is that he spent an entire career working a very demanding job with the fire department, while at the same time professionally racing off-road vehicles on the side. So there's quite a bit of wear and tear on his body. Let's get to the exam. The first step in a situation like this is to assess the person's physical structure. See, at its most basic level, structure dictates function. And so all I want to know right off the bat is, does this person have a physical structure that would allow them to move and function normally, or do they not? So what I'm going to have Steve do here is turn to the side so that I can see how his head lines up with the rest of his body. As you can plainly see when Steve turns to the side, the whole of his ear sticks out way in front of the center point of his shoulder, about 2 or 2.5 inches. Now that's a strong indication that he's lost some of the normal curvature in his neck, and we'll want to follow up on this with functional testing. Now I'm interested in seeing how Steve moves and functions. Because I know that his physical structure has deviated from normal, I fully expect him to struggle with performing even the most basic ranges of motion in his neck. Let me get you to turn as far as you can to the right, just with your neck. Okay, so 85 to 90 degrees is normal, and that's what we've got. Any pain there?
No.
Okay, let's do the other side. So more limited to the left than the right by a significant margin. Come on back to center. Now let me have you tilt to your right. Bring the right ear to the right shoulder. So almost nothing there. Let's see the other side. Normal in these circumstances is 40 to 45 degrees of lateral flexion, so that's what we're looking at. Let me get you to turn your entire body and face that direction, please. Perfect. And then go ahead and look up at the ceiling for me. Cervical extension, normal would be 60 degrees. Any pain there, Steve? Now that I've seen how Steve moves in an upright position, I'm going to perform what I call the forward head posture compensation test, where I'll have him lie flat on his back, and then I will put a bolster under his head that's high enough to bring his head into a neutral alignment, and then I'll retest his range of motion. When I elevate the headpiece here and give him about a 25-degree up angle, and then I reattempt right lateral flexion, I can go about twice as far there. And when I take him to the left, I can go significantly further. I don't even run into the end range until about there. So I gain about 10 degrees of left motion and 5 degrees of right motion. Rotation, likewise, I gain about 10, maybe 15 degrees of left rotation. And to the right, maybe about 5 degrees there, but the point here is significant improvement with elevation of the headpiece. An increased range of motion in combination with decreased pain and discomfort when performing this simple test is a strong indicator that abnormal posture is contributing to the problem at hand. Now I'm going to show you a fast and easy way that you can perform that forward head posture compensation test using stuff that you have lying around the house. To perform the forward head posture compensation test, you'll lie flat on your back and you're going to take a book that's about 1.5 or 2 inches thick and place it underneath the back of your head. Now, if you've got a forward head position, you're going to find that just having that bolster underneath there is going to make you way more comfortable in this position. And then you'll confirm that by going through a full pain-free range of motion in rotation to both sides. So slowly rotate as far as you can comfortably go to the left and to the right. Now, if you find that your range of motion is greater, you can move further with that bolster under there and you have less discomfort, that would be a positive indicator for a forward head position. And so in Steve's case, we're just going to take the next logical step and see how his pain and performance indicators respond when we begin reducing his forward head position and putting some of the normal curve back in his neck. And we're going to do that using the active traction unit. So what I'm going to have you do here, Steve, is stand up nice and tall. Push your head towards the ceiling, like the crown of your head, as if like you had a needle there and yeah, there you go. Now I want you to externally rotate your shoulders by turning your palms forward.
Both of them?
Yes, please. Just like that. Push your back up nice and straight, chest tall. Think like military foot locker inspection. Awesome. We're going to set a timer for 60 seconds and we'll see how he does. So we're wrapping up 60 seconds here. Steve's going to grab the head weight and lift it straight off of his head without moving his neck. Go ahead and grab it, lift it up. Perfect. I'll take that. So people often ask, how do I know that the active traction unit is working? And this is how you tell. After the session, you should have increased range of motion in the neck. So go ahead and rotate to the right.
While pushing it up?
Nope, just your natural position. There we go. Rotate to the left. Oh yeah. Yeah, so we're looking at like 75 degrees here, where he started with about 40 to 45 degrees back to center. And we'll have you look up at the ceiling. So look at that. 60 degrees is normal and we are knocking on normal. How much more comfortable does that feel to you, Steve?
Very, and I can actually feel my
Yeah.
skin stretch.
Stretching, yes, exactly right. That's what shortens when you have a forward head position. So here we have yet another test confirming that the pain and dysfunction that this patient is experiencing is directly tied to his head and neck posture. And when we add this to the other findings from his examination, it allows us to say with great certainty that posture correction is going to be an absolutely essential component in getting Steve to pain-free. Thanks so much for watching. I really hope that you enjoyed this week's video. If you want to learn more about the active traction unit, the most powerful form of posture training in existence, then click the link in the upper right-hand corner of your screen for a video that talks all about it. And if you want to see more videos like this one with lessons from real people with chronic pain, then hit that thumbs up button and make sure that you're subscribed to the channel so that you're updated when that next video comes out. That's all for now. See you next time.